We are very excited when the call came out for the request for applications for a NORD center to be recognized as a NORD center, because we feel sometimes, despite all these opportunities and ongoing collaborative projects, we have to get organized. We have to get better organized, and that designation of as a NORD Center of Excellence provides us with the vehicle to get organized, to build out a rare disease platform that may be a vehicle that would allow us to improve communication between the centers, provide information to all collaborating centers about what's actually available on campus. If I'm always surprised after 5 years of being here at Children's, how many investigators I meet that I haven't met before. I didn't know anything about their work. So we kind of, the plan is essentially also to provide a directory, a master directory eventually, that allows an individual researcher to go in and say, oh, well, I'm trying to query, I'm interested in a certain aspect of research. Who else is there who might have overlap, or who might have a technique available, an instrument available that's needed for my research? But it also provides a platform for patients and referring physicians. At the moment, we can go to the individual centers' websites and kind of query a certain condition or a certain specialty, but there's no one go-to place that would allow families and referring physicians to identify that information. So I think that's an additional aspect. And then thirdly, it also provides us with a unique opportunity to establish collaborations with other centers across the United States. I think that network aspect cannot be emphasized enough. It's really important to work together in the field of rare diseases, because we are not alone in this, and we certainly do not have the breadth, despite all the opportunities, to cover all conditions. So building up rare disease populations for natural history studies, registry studies, or even early trials really requires a larger network that we can kind of offer locally. So I'm particularly excited to be part of that, or our center being part of that broader network.